It's a word nobody wants to hear. It's a word nobody ever wants to have to say. However, that one solitary word will have a profound relevance to every single one of us at some point in our life.
You tell someone they've got cancer and they don't hear anything else, that's all they hear.
They told me on the day that I went that it was cancer. It is absolutely devastating. You just think, that's it, I'm dead. You really do.
So I went out and I talked to my husband Derek and I said, I found a lump. Will you check? And he found the lump and he was quite devastated.
I saw my dad die of cancer. So it was quite hard, but from the beginning I had a good prognosis. I knew it was positive.
Today is a special day in Calderdale and Kirklees. Gathering together for an exciting event are a group of everyday people who share a common experience. They've all been affected by cancer. It's the second year running that an event of this kind has taken place in the area, but for the majority of participants, this will be their very first experience of the catwalk. Spirits are high and nerves are beginning to creep in. The models have been practicing for what will be for them and their loved ones a poignant and meaningful moment.
Not long now, I'm getting very nervous now. Yeah. Quite a few trips to the loo. And I can't remember any of the routines, so I just hope they all come back to me when I get on the stage.
Really, really nervous.
I'm petrified, but I'm looking forward to it. I'm just going to look out of the window. not going to look at any faces.
Whilst the models may well be fretting about how the fashion show is going to go tonight, the truth is that each of them has had to overcome a much tougher challenge. Every single one of them has had breast cancer. Christine first became aware of a problem after a routine checkup at a mobile breast care clinic almost 8 years ago.
I didn't have any symptoms at all. No lumps, no bumps, no nothing. In fact, I was very well. It was through the caravans that I discovered I had breast cancer. I'd been before and it was just routine. So it didn't bother me going. Not even when they called me back did I bother, because sometimes things are not easy to detect. But then when I had a third, I thought, yes, I've won a prize here. I just know it.
Christine's partner on the catwalk, Diane, discovered a lump whilst in the shower 2 years ago.
I went into the shower one morning and was checking, as I do regularly, and I found a lump. And I thought, no, it's not me. So I checked again and I rinsed and washed my hair and I checked again. And I thought, yes, I do have a lump. And I have a fairly big lump.
Although the majority of women with breast cancer are over the age of 40, people much younger can and do get breast cancer. At just 21 years old, when cancer is the thing the furthest from most people's minds, Lindsay had to face a devastating diagnosis.
I was 21 when I got my diagnosis. I do have a history of cancer in the family, but not breast cancer. So when I found the lump, I didn't expect it to be out serious. I just thought at my age it were impossible. When I finally did go to the doctors and they referred me to the breast clinic, they told me it were a 1 in 25,000 chance that it would be anything serious.
Veronica is a specialist breast care nurse at the Calderdale Macmillan's unit. She is one of the main points of contact for people who are diagnosed with breast cancer and is present when patients are given the news.
A patient will get referred from the GP to the outpatients department with a query, a lump or something in the breast, and they'll be seen upstairs by the surgeons. They will then go up for mammography and some tests to check and to see what the lump is. and then they'll return to the outpatients department and be given there their diagnosis of breast cancer by the consultant.
I had a mammograph, I had ultrasound. The consultant said, come back, Diane, in 10 days. So I waited and I was very, very anxious. And then I came in again and Veronica, the breast care nurse, was in with a consultant. Said, Diane, yes, you have got cancer.
When Lindsay returned to the clinic for her test results, she felt much less anxious. She'd left a friend in reception and was totally unprepared for the shocking reality that was awaiting her.
Because I'm a nurse, I remember seeing the specialist nurse in there thinking, she's there for a reason. She said, do you want me to get your friend? And I said, no, why would I need my friend? I'm fine. And she went and got her, and then I knew then. I was shocked, really shocked. Next morning when I woke up, you know, for a few seconds I thought it were all a dream.
Sarah found an unusual lump only 3 weeks before she was due to give birth to her 4th child. After insisting further tests were carried out, she was devastated to find out that her fears were, in fact, reality.
I was 37 weeks pregnant when I found a lump, and were told by midwives and the doctor that it was nothing, it was just hormones. But I have had 3 children before that and knew that it wasn't normal, so I insisted on seeing a consultant. And when I did go and see somebody and they did tell me on the day that I went that it was cancer, it is absolutely devastating. You just think, that's it, I'm dead. You really do.
You tell someone they've got cancer and they don't hear anything else, that's all they hear. And they're really scared and they hear no more information. So we'll take them off after that consultation with the doctor to a separate room with as many of the family as they want, and we'll go through it all with them again. We'll go over it 10 times till they understand what we're telling them, what their treatment plan is going to be, and then they'll go home and hopefully they'll feel a bit easier. They know where they're going, they know where the journey's starting and who they can contact to give them any information they need.
I had to have a mastectomy. The lumpectomy did not do the job, so I've had 2 very quick operations. And then chemo, which I thought was absolutely dire. Hated every moment of that. Would have been happy not to have had it because it was chemical and nasty and it made you feel very ill, which didn't make sense to me. But that's just my personal view.
After a gruelling few months of treatment, Christine felt relieved, as she thought she'd come through the worst of it, only to find that she was going to have to go through the whole process again.
We got through that, and then we had to go again with the other side. And we had to repeat it, but this time I thought, well, we'll just take all the breast away and then think about perhaps putting them all back together at a later date.
As Diane's experience indicates, initial treatment from the day of diagnosis is usually very quick, with most patients receiving it within 7 to 10 days.
Within 10 days I was in hospital. I'd had the lumpectomy. I'd got scars because they'd taken lymph nodes as well. I was very uncomfortable for a few days.
Diane was also surprised to find out that she didn't have to have chemotherapy.
Veronica said, well, you have a choice now, Diane. You could have chemotherapy. It's not absolutely vital. I thought, not vital? I thought it was.
The treatment will differ according to the individual rather than the type of breast cancer. It depends on their histology and their age and stage of disease as to what treatment you give them.
As Veronica indicates, every single case of breast cancer is unique, and the appropriate treatment plan is agreed upon by a team of cancer experts in response to a huge array of variable factors, from size and type of cancer, symptoms displayed, recuperation times, and the effectiveness of different treatments. So it was after careful consideration that Diane decided to have chemotherapy after all, because this would give her a better chance of eliminating the cancer completely.
We said, well, there are 6 treatments, Diane. Not everybody, because of the strength of the drugs, can cope with it. So I said, well, we'll go as far as we can go. How many have I got to have? I said, at least 4. I had 3, And then I had phlebitis in my arm where I could see all the drugs going up the arm. Anyway, we got through that, but I only had 4 treatments.
Like Diane, Lindsay underwent a lumpectomy followed by a course of chemotherapy. Luckily for her though, the side effects were less severe.
From the beginning I had a good prognosis. I knew it was positive. I'd have the lump removed and it were all positive really. Didn't get many side effects from chemo, so because I didn't feel poorly, I didn't want to be treated like I was poorly. I just wanted to carry on. That was my way of dealing with it, keep things as normal as I could.
Sarah also had chemotherapy. As with most patients, she did begin to feel and see the side effects towards the end of her treatment, the most obvious being her hair loss.
Felt fine all the way through having chemotherapy until about the 5th and 6th session, when it does make you feel quite sick, but it's only for a couple of days. But the hair loss is quite a big thing. It's not nice when your hair starts coming out, but you get past it. I did have long hair and they told me to have it cut short, so I had it cut into a bob, and it sort of went from there to there, being bald, but I still had the back, so I just wore scarves to cover the bald bit and just had my own hair at the back. As it got thinner and thinner, I decided to wear the wig, and the wig is actually just as my own hair was before I had it cut short, same colour and everything. And people that I haven't seen since April, before I wore the wig, they just don't know any difference, especially if I've got scarves on top of it, and that keeps it on my head as well. I tie them tight so it doesn't drop off.
Breast cancer affects on average 41,000 women annually in the UK alone. About 2 years ago, David, much to his surprise, became one of the 250 men that year to be diagnosed with what is often considered a female-only disease.
I have lumps and bumps all over my body, so it was just a case of it's another lump. But my family were quite insistent. I went to the doctors, I had the mammogram. This is strange, because you'll never get my little things in there. Women have got nice breasts to go into a mammogram machine, but they got mine in. But they asked me if I could go to Halifax for a biopsy. This was like Tuesday. Can you get there for Thursday? Yeah, no problem. Went over there, had my biopsy. So I reported to clinic on Friday, 19th of December, a date I'll always remember. Went into the room, doors closed, and she said, right. She said, we found the lump, we had it checked out, we had a mammogram, we had an ultrasound, and I'm sorry to say the biopsy confirmed that you got breast cancer. And I just, whoa, no. That's a woman's problem, men don't get breast cancer, and I was gobsmacked.
Most people are shocked to discover that men can even develop breast cancer, let alone the fact that hundreds of men a year require treatment in the UK alone.
The treatment for breast cancer is exactly the same as the women, but all the literature and all the focus is on women, and men see it as a female disease, so it's quite emotionally hard for them to come to terms with the fact that they have breast cancer as well.
I never heard of men with breast cancer, at that moment in time, so it was really, really alien to me. Strange, really strange. The literature I was given, there's about one paragraph that said men can get breast cancer too, and that's it. Everything else is woman-related. So I couldn't comprehend this.
The realisation that men can also get breast cancer, combined with the lack of male-oriented literature, prompted David to take part in the fashion show in order to raise public awareness of this relatively unknown possibility.
I think people need to know that men can get, I don't want anybody in that position. I trawled the internet looking for information and found it very, very rare, very, very scarce. It's just very hard being a man with breast cancer because everything's woman-related.
Veronica and her team are always there to help everybody who's diagnosed with cancer deal with the effects of the shock. Both patients and their families often undergo a variety of emotions when faced with a painful reality.
It's very different how people react to the news. Some husbands and partners can be very supportive. Some can be very scared and you can almost see them pull away. Patients can be very embarrassed that they've even got a cancer. They feel they're letting everybody down.
Sarah vividly remembers the day she was told she had cancer. After hearing the diagnosis herself, she was then faced with returning home to tell her children, illustrating that the emotional impact of the disease frequently affects anyone and everyone, from the patient through to all their family and friends.
It takes a while to sort of bring yourself round, and it's really shocking, it's horrible. And not only for you, but for your children and everybody, because I had to go home and say to my children, I've got cancer, which is just horrendous.
David attended the hospital on his own and had to break the news to his family after leaving, something he found particularly difficult.
Leaving the hospital after being released and getting all the literature, I just sat in my car and just trying to get it all in, just thinking, well, how do I tell my family? I've got to phone my wife and I've got 2 children, and they're both to explain. I sat in my car for about 20 minutes before I could get my mobile out and phone my wife and just tell her.
Christine feels very close to her relatives, and breaking the news would not normally have been a problem. However, she didn't want to tell them straight away for fear of spoiling an upcoming social occasion.
It wasn't easy to tell my family because we had a family wedding in 3 weeks' time, and you don't want to drop something like that on a wedding, do you? It would make a miserable job of it. So I left it, and then I made it known. We're not desperately panicking, but it came in waves of, oh my goodness, is this as big as it sounds? Is this really what it is all about? And then in another time, we just kind of coped because we were all batting together, and I thought, well, I've got to keep okay for the rest of them. I don't want them to go down worrying.
Many people who have treatment for breast cancer become very self-conscious and lack the confidence they had before the illness. As such, a group at the Calderdale and Huddersfield Clinic were determined to show that having breast cancer does not mean the end of a normal, enjoyable life. The fashion show was planned not only to make people aware of breast cancer, but to also show to the people taking part that they're not alone, that having the disease does not have to limit their life, and that they can still have just as much fun as ever.
A lot of ladies needed their sort of body image improving. We wanted to show them how good they looked. We did the first show last year, and the success of it was focused around how good those ladies felt, how supportive their families were, and amongst the models who sat and talked, they supported each other because they realised they weren't on their own with how they felt and how they felt about how they looked and how they coped with the treatments. They turned into a very supportive group. So we decided we must repeat that fashion show this year for a new group of models.
I'm absolutely loving it. It's just a matter of meeting up with people who you don't know at all, but share an awful lot that you have gone through. And in fact, sometimes you don't even have to mention it. It's just knowing that you're with people that are understanding of where you're at without actually saying an awful lot. And you can have a very good laugh as well, which I think is very therapeutic, is laughing at your situation, because it's not funny at all, but there's a lot to be said about humour, and this is what brings it out, I think, when you're all together.
Diane was present at last year's show and recalls the nerves, excitement, and even a certain amount of intrepidation for all involved.
Nobody wanted to do the show. They were all embarrassed. Were they going to fail? Were they going to fall over? And as the day progressed, with Bernadette's help, we all got through. And we had a wonderful day, getting dressed up in all the beautiful clothes and gowns and shoes, and actually going on stage on that night. The audience were phenomenal. They clapped, they whistled, they shouted, and it was great fun, as long as we all remembered to look at the chandelier and not down at the audience.
David is also finding the fashion show of great personal benefit, and also an excellent opportunity to meet other people in, as he now sees it, the same situation as him.
It's a good idea to get everybody together, male and female. I found it a great opportunity to meet other patients, because everybody in this fashion shoot are all at different stages. You know, there's people still going through treatment, there's people that's had treatment, and there's people that's well behind treatment and well on to recovery. A lot of women here, probably the first time they've met a man that's had breast cancer, you know, like myself in the early days, unaware that men could get it. So we can swap stories, swap feelings, see how each other feels, see what people are going through, and it's brilliant way of getting people together, you know, something like this.
Sarah feels immensely relieved to be here today because it's a stark reminder of how she felt when she was first diagnosed.
Veronica asked me to do it the first time I saw her in April, and I just never thought that I'd get to this day, but I have done, and it's fun and it's brilliant and you feel special, and you're massaged, you have your hair done, well, your wig done, your makeup done, you have absolutely gorgeous clothes that you would never ever wear anywhere, because I only got to Sainsbury's in high school. I'd tell anybody to definitely do it, because and you meet other ladies that are all in the same situation as you are, ladies that have gone through what you've gone through, that you can ask them about treatments, and I've made friends today as well, which is fantastic, and I hope I'll keep in touch with them, see how they're going on.
Lindsay, although very nervous, is also glad that she decided to take part in the event. Not only is it a great experience, but it's also been a chance to meet other people in a similar position.
I'm really glad I'm doing it. At first I was nervous, I'm nervous now, but it feels like an achievement because we've all got through it and we can all share as experiences, and it'll be a good day.
This year's event includes dozens more of first-time models, in addition to Lindsay, Sarah, Christine, Diane and David, all of whom have fought cancer.
We've just come out, we're having a huge glass of wine and we're going to go in and everything works all right, but we're in swimwear and lingerie and the changes are going just nuts. So let's just hope it works when we come out.
I only had an operation in July and I was asked when I went back if I'd do it, and I just said, "You think it's a bit soon?" And Veronica said no, so I've gone for it. I'm here.
Absolutely brilliant, brilliant. Couldn't imagine it to be as it has been.
I'm actually wearing a corset and it feels like I'm reduced down to half a lung with it.
I'm breaking the ice for everybody else. Let's hope it goes fine. So I've forgotten my routine already. The nerves are upside down and I'm glad when it's over.
The preparations have literally taken months and encompass every aspect of a professional show for both front of house and for the participants. Hair, makeup, music, lighting, photography and, of course, a complete range of outfits are all ready for the public who await a very special show.
It's just lovely to see the girls getting on with their lives, carrying on. Just keep going, be strong, you can do it.
This has been terrific. This has been a real boost, you know, a real pick-me-up.
I'm really, really pleased, you know, we've all got together.
It's good to hear, you know, the different treatments that we've all had and the different ways we've coped with it, how people have felt with it. And yeah, I've really enjoyed today. It's been really good.
When you get told at first you think that's it, at the end. You don't, because you carry on and you see what happens, and 10 years later, it's brilliant.
talking to other ladies who've been there helps you put everything into perspective. It really does help the perspective on it.
Just take one day at a time. Shed a few tears, but we got through it, we got it sorted out.
You do have bad days. I still have bad days when you sort of start panicking and cry, but you just get on with it and that's it. There's no other way but just to think, right, it's just a time in my life that's going to pass and that's it. And my hair will grow back as well. It already is, and I quite like it short.
If you lose your health or you lose your parts of your body, there's a lost thing that you have to get over. You can make certain changes to your lifestyle. I work less, I eat differently, I'm certainly a lot slimmer, and I do a lot more on my bike. I get a lot more fresh air. It's a different lifestyle, better, a lot better.
The thing to remember is that all of the people here today have dealt with breast cancer in their own way, and everybody who encounters it will indeed find their own way to deal with it. Such is the strength of the human spirit. As a final thought though, breast cancer is perhaps best described using the words of one of the models here. When I was diagnosed, I thought that was it, the end of the story, but in actual fact, it was just another chapter in my life. There's a long way yet to go until this story's finished.